colleagues in the SCARF board, friends, well-wishers, welcome to all of you. This is a particularly important occasion for us. IconS is now 25 years old. To develop a platform of this nature and keep it thriving for 25 years is no mean achievement, even if I say so. We are truly proud for having developed this and brought the community together, and for all the wonderful work that has been carried out by the ICON associates. So this is also a very special evening for us, because it is not merely because it is a 25-year-old initiative. It's also because today, in this context of a very divided world, where national boundaries are very thickly drawn, where even goods and services do not have a free flow, there are tariff barriers and all of that, technology is very often weaponized, commercialized no doubt, but weaponized as well. The only island of hope, the oasis of hope that we have in the world today is the fact that scientists, very distinguished guests with us. Our chief guest, Dr. Ashu Grover from ICMR, needs no introduction. We extend a very warm welcome to you.
Presented on this theme, and to kick off, we have none other than the legend in schizophrenia, Professor Macheri Keshwan, delivering the 6th Sharda Menon oration on cognition as a core aspect of schizophrenia. We have had 370 registered delegates from all over the world: India, Canada, USA, Australia, UK, Ethiopia, Nigeria, Trinidad, and Singapore. We have 18 symposia organized, as well as 12 plenaries to be delivered by eminent clinicians, researchers, service users, and caregivers. We have received 20 research papers for the Young Researcher Award, of which 8 are selected for the competition. We also had 58 posters, which are going to be displayed over 3 days. So I welcome you all to the wonderful 3 days of scientific feast, and I hope you enjoyed, and we hope to see you again in the next edition of IconS. Thank you.
Consistently, we are a part of IconS for a long time. And let me place on record that any institution which is nearing golden jubilee, and an IconS which is actually conducting silver jubilee celebration, deserves congratulations. It is only the very dedicated effort and work which will actually carry this particular level. We have our Vice President, Dr. O.P. Singh here. So also my teacher, Dr. Jacob Jan, many people with whom, in fact, I was at CMC Vellore. I had come to Chennai for our training program, and I very fondly remember a lot of good memories.
To everyone, respected dignitaries on the dais, and my friends of the dais. First of all, thank you, Dr. Thara, for inviting me to this very, very important international conference organized by Schizophrenia Research Foundation, and we're celebrating. Congratulations to you for celebrating this 25th Silver Jubilee of this organization. And thank you for introducing me. That I'm a family of Indian Council of Medical Research. This ICMR is a part of the Ministry of Health and Family Welfare, Government of India, and this is an organization which is the oldest research organization in the world. It was established in 1911, and we have completed more than 100 years of giving the outcomes, the knowledge, and so many outcomes from this organization, not only to the India but to the world as well. And the last example was that ICMR has tremendously given a lot of contribution for COVID pandemic as well, for which we really take a proud on it as an Indian citizen, that yes, it not only earlier that everybody, ICMR was a common name among the medical fraternity and some of the government organizations, but today every Indian citizen knows that what ICMR is. Somebody asks you that, who are you? So we belong to ICMR, the one who had developed the COVID vaccination, and they have given the COVID vaccination to the entire population. So that is what the strength of Indian Council of Medical Research is. I am here, I would like to thank, first of all, my Director General and Secretary, Department of Health Research to Government of India, Dr. Rajeev Behelji, who has kindly agreed for me to be part of you as a kind of a deliberations and put forth some of the ICMR's perspectives and the ideas in front of you, that what ICMR is doing right now. ICMR is a grant giving organization, but what in the grant? So we have seen over a previous 2-3 decades that we are not able to, as a country, as a health, specialists or as a health providers, our communicable diseases problems are yet not solved, but the non-communicable diseases are still surging up. So it is very, very tough for us as a citizens, as a healthcare providers, to take care of the entire perspective of the communicable as well as the non-communicable diseases. So when we talk about the non-communicable diseases, we largely think of only 4 conditions, which is heart attacks, which is stroke, diabetes, hypertension, and nonetheless the oncology, the cancer part. Usually the mental health is standalone, not counted as a part of the non-communicable diseases. So if you think of the program, which is a national program for NCDs, has also focused only on those 4 conditions. But I am very sure, and it is not a matter of a pride, that if we count the, if we go with the prevalence and the data on diabetes and hypertension, mental health prevalence among all the age groups would be much higher than any of these 4 conditions. I mean, this is what is coming up from the latest surveys, and this National Mental Health Survey, and also has really talked a lot about it. So that is the spectrum of the problem, and it is quite visible from ICMR perspective also, that as we get large and large number of the grants, the number of research proposals which are submitted to ICMR in the area of psychology or in the mental health is also rising. So reason being that there is a lot more problem which has to be addressed, which needs to be undertaken at large, and fortunately, I will again, fortunately word comes because we want to fund more and more research grants. That is how I say that, okay, the proportion of the mental health research among NCDs in my division is almost 30%. If I take the all NCD grant which is submitted and funded, around 30% of the share is taken by the mental health alone among non-communicable diseases, but the entire division, it still remains as a 10 to 15% of proportion like that. So it is not that we fund more and more proposals for the mental health, but what is important here to understand is that we all know that what are the interventions which will be there to address the mental health issues, starting from the primary healthcare level till the tertiary healthcare level. Right? So we know what all the interventions, could it be the pharmacological interventions, could it be the non-pharmacological interventions, and newer issues, newer therapies and newer papers keep coming on, as which has been said by the today's whole session and the tomorrow session and day after. So those things are really coming up, but how to take up all those interventions at a program level is again a bigger task. So development of the newer modalities of intervention and taking up those interventions to the grassroots level for the betterment of the population is also equally important. This is what the efforts of Indian Council of Medical Research has been doing by undertaking many mental health research work, and two of the research projects which are at length being run countrywide is one, integration of mental health into the non-communicable diseases program. Whosoever is coming to primary, secondary or tertiary healthcare level at least is screened up for having some mental health issues. It may not be the severe, it should be like common mental disorder also. Earlier it is picked up, better it is for the management or the providers also to tackle. And the second important national health research priority project what we have is on the suicide prevention. So this is one of the priorities which ICMR is doing for NHRP, but there are many other small investigator-initiated research projects which are going on, and we have two good research projects being undertaken by the SCARF as well. So, other message which I would like to give to the younger generation and to the mid-level faculty who are all here, that it is all, if you want to see areas growth or institutional growth, is by undertaking good research projects. So it is through research projects only you can generate newer knowledge, and you can make the difference into the institute as well as to the population for which you are working together. So writing good research grants is again had been the mandate, and I would definitely take a pride in saying that the research writing skills are not as good as other countries we have, but we are still very lagging behind in writing good research grants, whatever area of work we are having that. So we have a model, and this is the mental health model which has emerged from people among you. And we have Dr. Smita Deshpande, who is sitting in the audience very quietly, has given ICMR a model which is called as a Grantathon, and it is going into its third year, wherein we have a group of researchers who are trained by a trained researcher, and another group of funding people becomes the mentors, and so on, the cycle goes on. So this is the model which ICMR has been, and ICMR will keep repeating such kind of a model. It started with the mental health, and we can take it for other conditions also. So Grantathon is one initiative which ICMR has really taken it forward, and it has gone across the borders as well. And I guess it has trained around more than 100 such researchers across the country, and they have been taking the work on various areas, could it be the preventive, promotive, curative or rehabilitative models of the research. So those are some of the issues and aspects which I would like to definitely share. But again, the mental health research agenda, you all know that who's all stalwarts you mentioned. I may not be remembering all those names you mentioned because it is your fraternity and all that. But one thing I can definitely say that by inviting me over here has opened the doors for all the potential researchers who are really keen to work along with Indian Council of Medical Research. The doors are open, and the budget is not at all a crunch. So it is all depends upon all of you, that if you have undertaken a kind of a pledge that we really want to work and solve the mental health related issues by doing research work for this country. So ICMR always stands beside with all of you. We don't want the budgetary to be given to National Institute of Mental Health and Neurosciences, Bangalore. New Hands takes a lot of budget. So is the St. John's, takes a lot of budget, and so is the AIMS, PGI and all that. But all those smaller institutions, the medical colleges and research organizations, I was speaking to other alliance people also. So that is again that somebody says that ICMR funds only to the government organizations. So it is not the scenario like that. We have been funding to all those organizations who are, government is okay, but in the private organizations also who have a proven good track record of the research. So doors are open to even the private organizations also, so that whosoever wants to work on for the mental health research agenda can come forward. So we can plan specialized workshops, like the Grantathon can be done in a multiple ways to the medical colleges. The proposals can be improved upon, but with the only aim is that all the research outcomes have to be aligned to improve the population health outcomes. The research projects should not be only limited to that only the investigators who are submitting the grant, it benefits them. It should not end it only with the publications. It should have a very clear outline that how are we going to integrate it into the policy or to the program. So that is very, very important for all of us to understand. So I wish this conference a big success, and again a big thanks to the organizers for inviting me and representing ICMR, and I hope that this my talk of 5 to 10 minutes is going to ignite among you that yes, the research is equally important if you really want to make a difference in anybody's area of work or anybody's area of population. Thank you so much, and thank you one and all.
She was awarded by various organizations. One of the notable award she got few years ago is the Nari Shakti. More important in our country, we need dynamic leaders who can innovate and take this movement forward further and further. Of course, the treatment gap is enormous. Community involvement has to be innovatively enhanced, etc. So this award is for young emerging leaders, not just researchers. Anybody from the field of mental health, any mental health professional, psychiatrists, clinical psychologists, psychiatric social workers, psychiatric nurses, including community advocates for mental health. Anybody, 40 years.
For the delay, I was held up with some meeting. And it's a great pleasure and honor to be part of this celebration, 25th Silver Jubilee, 25 years of excellence in mental health. And that's some words which really mean what they say. And I have to, from the health fraternity and from health department and government, to thank SCARF for whatever work they have been doing, for advocating, for training, for collaborating, and for initiating so many things in mental health sphere. And we are very thankful for your contribution to mental health. And actually Chennai and Tamil Nadu are blessed with excellent organizations which give great direction and great evidence. I think Sneha Madam is here, Lakshmi Madam is sitting there. So Madam's research on suicide prevention has really gave us a framework on how to approach that another tough problem. So as far as health systems are concerned, as all of you are aware, from the Millennium Development MDGs, concentration on maternal and child health, the systems are slowly gearing towards changing to SDG goals. And that shift in our priorities itself is very tough exercise. And maternal and child health is something which MDGs gave a lot of importance to, and that there are a lot of investments and a lot of time and effort has been put in there. It's very important and critical. But then there are other new challenges emerging, like if I say non-communicable disease and SDG goals, which has really talked about all this, but the health systems have not really, we are not able to really gear them up to that level which is needed to achieve the SDG goals. And mental health, as you see, is a very critical part of any health system. And if you look at our approach, district mental health program, national mental health program, and our departments of psychiatry in medical colleges, at the population level, what exactly is happening in the mental health is very critical. And unless until we are able to deliver the services at the population level, like we deliver to maternal and child health, this critical aspect of healthcare will always have a bigger challenge. So as a health system, if any of you would have gone through our new announcements, our endeavor is to integrate mental health into our health system from the sub-center up to the medical college level. And this integration is a challenge, and that is where organizations like SCOF, Sneha, Banyan, and a lot of other organizations have always stood with us in training, in showing how different models. And as now the health secretary, I can say I was MD NHM for some period, some time back. So I can always say with confidence that we have a lot of models which we can emulate. And how do we integrate mental health into public health system is a critical challenge facing all the health systems across the country. And that is where again we need a real policy level understanding also, and not only understanding, policy level implementation. On policy level, how do we get this done beyond the DMHP level? So in Tamil Nadu, if you know, we have district mental health program, we have a district psychiatrist, and we have a satellite psychiatrist. But then two people really cannot solve the whole problems of public mental health program. And this is where we are again restructuring, and I would like to again emphasize that our efforts are not really, we are not able to completely translate or transform the way the mental health is delivered in primary health centers or even in sub-district hospitals. So that is really the aim for us in the future. And along with that, there are so many other issues which we need to tackle. And State Mental Health Authority, I think we are in the process of finalizing the regulations. So that will also give an impetus in having a structured mental health delivery in the state. So I think I've randomly said some things, madam. So I will be very happy to listen to the lecture. I hope the lecture is due next. So thank you for the
Rajkumar and Dr. Tara. It was at a time when the state might have had little to offer a person with schizophrenia. Perhaps nothing more than a bed in a hospital. And these were persons who had worked obviously within that system, but they felt that there was a big space to fill. And they had to go to areas where the state couldn't go to at that point of time, or was perhaps disinclined to operate in, and the market had certainly no reason to do it.